Welcome back to another clinical deep dive on Dr. Ikram Explains. Today, we're unpacking a really fascinating intersection, the exact point where evidence-based medical physiology collides with profound, deep-seated cultural belief. We're looking at Dhat Syndrome versus nocturnal emission. We're going to explore the myths, the reality, and the clinical management of both. It's a journey that's going to take us through biology, psychology, and global healthcare.
Okay, let's dive right into this. Is it a disease or a completely natural process? It's a simple question, right? But it sits at the very heart of a major clinical confusion. All around the world, healthcare providers frequently encounter situations where a completely natural biological occurrence is confused with a highly distressing psychological syndrome. One is entirely harmless, the other can cause severe anxiety and literally disrupt a person's entire life.
Here is the roadmap for our explainer today. We'll cover the physiology of nocturnal emission, Dhat syndrome, and culture, biology versus psychosomatic distress, the clinical diagnosis, and finally, evidence-based treatment steps. Let's get to it.
Section 1. The physiology of nocturnal emission. The biological reality.
So the clinical definition of a nocturnal emission, commonly known as a wet dream, is actually incredibly straightforward. We're talking about a natural, completely involuntary release of semen that happens during sleep. This is our medical starting point, right? A standard physiological function of the human body, devoid of any pathology whatsoever.
This brings us to the biological overflow theory. Look, the human body produces semen continuously. It's just what it does. And if that fluid isn't released through other means, the body essentially acts on its own to expel it naturally while you sleep. It's basically a biological autoregulation mechanism. Now, the frequency of these emissions, it varies wildly from person to person. But the absolute most important takeaway here is that this natural expulsion does not, in any way, shape, or form, indicate physical weakness or a decline in health. It is literally just biology at work.
All right, let's move to Section 2, Dhat Syndrome and culture. The psychology of loss. Now, Dhat syndrome is recognized clinically as a culture-bound psychiatric syndrome. It's primarily found in the Indian subcontinent, and it is deeply, deeply connected to the traditional Ayurvedic system's views on health, vitality, and bodily fluids. The syndrome itself is defined by an intense, experiential fear of losing semen. We're talking about the fear of losing it through a nocturnal emission, normal ejaculation, or even just passing it in urine. And because of these very specific cultural roots, healthcare providers globally often miss the science, which makes understanding this absolutely crucial for global medical education.
In certain cultural contexts, there is this incredibly deep-seated belief, a literal conviction that semen loss leads to physical decay. And when a patient holds this belief as an absolute truth, that natural biological overflow we just talked about, it suddenly morphs into a perceived medical crisis. This belief drives intense psychosexual anxiety, profound guilt, and some very real somatic symptoms. The patient genuinely experiences extreme fatigue, palpitations, and physical weakness, all stemming entirely from the terror of losing this vital fluid.
Section 3. Biology versus psychosomatic distress, a tale of two realities.
Now, what's really interesting about this is the stark contrast between the two mechanisms. On one side, you have a nocturnal emission, an involuntary biological regulation causing zero physical harm. On the other side, you have Dhat syndrome, profound psychosomatic distress over those exact same normal body functions. It's not just a minor worry, you know? If left unaddressed, the impact of Dhat syndrome can be catastrophic, leading to clinical depression, overwhelming anxiety, and complete social withdrawal. The mind is literally interpreting a harmless biological event as a massive loss of vitality.
Moving on to Section 4, the clinical diagnosis, decoding the distress.
If we look at how we actually diagnose this using the ICD-10, we categorize Dhat syndrome in a few specific ways. Typically, it falls under code F48.8, which covers other specified neurotic disorders, and flags it as a culture-bound syndrome. But the core pathology, that's often linked to code F45.3, somatoform autonomic dysfunction. Essentially, the patient is presenting with a somatic symptom disorder. They have all these physical symptoms, like severe fatigue or weakness, which they firmly attribute to the loss of vital fluid. And it is absolutely critical to understand that generalized depression and anxiety very frequently tag along right beside these vague somatic symptoms.
So the crucial point here for clinicians is that you have to treat the perception of the loss, not the physical loss itself. This is not a urological pathology. Your goal isn't just to, test the urine for semen. The goal is to address the underlying psychosexual anxiety. And because this is so tied to culture, providers have to use cultural humility and a strictly non-confrontational approach. If you just dismiss a patient's cultural beliefs right out of the gate, you're going to alienate them instantly. Instead, the focus has to be on managing the immense distress those beliefs are causing.
Finally, Section 5, Evidence-Based Treatment Steps, Management Strategies.
Okay, so how do we actually help these patients? The management strategy is a systematic, 3-step, evidence-based approach. Step 1 is psychoeducation. This means gently and respectfully explaining that the natural loss of this fluid does not actually deplete their energy or cause physical decay. Step 2 is counseling, specifically cognitive behavioral therapy, or CBT, which we use to carefully challenge and reframe those deeply held myths about sexual health. And step 3 is medical consultation. If the anxiety is hijacking their daily life, getting a psychiatrist or urologist involved is highly recommended. In fact, medical treatment for Dhat syndrome often mirrors the exact treatment for major depressive disorder, which frequently means prescribing SSRIs to tackle the underlying clinical anxiety and depression.
As we wrap up, we always come back to this core takeaway. Knowing the difference between a physiological baseline and a severe psychological syndrome is the absolute first step toward mental and physical wellness. For both the patient and the healthcare provider, separating pure biological facts from intense cultural anxieties is vital for delivering proper, effective care.
I want to leave you with this provocative thought today. Just how powerful is the human mind in creating incredibly real, debilitating physical symptoms purely from cultural beliefs? It's kind of mind-blowing, right? It's a stark reminder of the profound strength of the mind-body connection. Thank you for joining me for this explainer. Be sure to subscribe for more clinical deep dives into Dr. Drekram Explains. Keep learning, stay focused, and I'll see you in the next one.